My name is Dr. Are, Abdulhafiz. I am a medical doctor and was trained in Olabisi Onabanjo University, OOU. After all the stints, medical school, like most doctors, graduated and did my house job in Abuja. Now, after the house job, the next thing was thinking about what next to do. Basically, the transition for most of us regular doctors is that we want to do our residency, we want to do internal medicine, surgery, O&G, or any of them, any of these fields, and just specialize in one of them. But I had to think outside the box and think, okay, what can you do, or what can I do basically to still make a mark and do something a bit different. And then we came up with the most interesting or emerging field in medicine, and that's what we call electronic health. Now the steps to going towards e-health now meant that we're going to have to do our own, based on our own curriculum. So I went for a master's in hospital management information system. I chose University of Liverpool because it gave me the chance to do it online and yet still continue looking at how Medicare can affect people here in Nigeria. I had to do another stint with MIT in India, basically, and then did a little thing on hospital management itself. Now, with all this experience, with all this, for me, they were just documents, they were just papers. At the end of the day, the challenge was to put what we had learned, what we had picked up, and see how we can affect people in mass. Now, what's different? The difference is the fact that I chose to do what other people would not do. So I did. It's like taking a risk and not knowing where you will fall into. And usually when you do that with a lot of belief and hard work, I think you actually most of the time fall into the right path. So what happened was simple. I probably was the first doctor in Abuja here or first or second, because I think I've heard of one other person. So first or second person that would actually stick to electronic health. Now, electronic health itself was not, it wasn't new, but more or less it was kind of novel to our own healthcare system. Now, it's the same thing that you do in America or you see in UK or in Canada. One of the best countries you find it well established is Canada. Canadian system is very, very well, is well integrated. So what we try to do is to link hospitals together, link patients to their doctors, link doctors to doctors, then link department to departments. In other words, you try to affect the healthcare in total. So it's more or less a pragmatic approach. So while a regular doctor will see one patient and affect one life, or see another patient, or see a family, we at the end of the time, we try to work from up down. So we see a collection of people, numbers of people, thousands of people attending a particular facility. So when you try to improve, according to WHO, what you do is that you try to you strengthen the health system. So that's what we try to do. So we strengthen the health system. Once the health system is strengthened, it means that the health care that will be received by people down in the populace, obviously, will have a strong fulcrum or a strong basis or a strong foundation. So then it makes healthcare more efficient, mobile, secure, and so on and so forth. So basically, for me, it was adapting and bringing that. I felt like Obama, let's say it that way, because he was probably the most courageous leader that America had in recent times, besides JF Kennedy, of course. And he went where other people won't go. He took healthcare as a strong point and introduced the health IT. So that was actually where the boom in health IT came, telling us that you can actually bring healthcare to people using information technology, which means that people can have mobile and efficient and actually have access to it without even being in the hospital. So in other words, patients will feel more secure, patients will feel closer to their doctors, and at the end, you're changing the outcome of health. Now, practically, the first 1 year of practicing and bringing in healthcare, what we had to do was we had to come up with, we had an organization called Premed. Premed was a wellness center. As I said, I was always thinking about preventing people from falling sick before managing them. So it was, preventive care was interesting. So we already had a wellness center. We had spas, medical spas, where people do all that, preventive measures and all that. So we now brought in Premed eHealthcare. So Premed eHealthcare was one other Premed Diagnostics. When it started, we were thinking, okay, where do we start from? Our hospitals are already, everybody's used to the manual things where you go to the hospital, you get a card, the card gets missing. Of course, you can't keep on keeping your card every day. So the card gets missing, but you suddenly fall sick in the next, maybe 3 weeks after the last visit to the hospital, and you don't have this card, and you come back to the hospital, you meet them at the record and tell them you want your card so that the doctor, because you're not going to see the same doctor, you're seeing a new doctor, and he wants to do it full up. He wants to know what has been done to you in 3 weeks. He wants to know what you were given. He wants to know what drugs you had. He wants to know what investigations were carried out. So you don't have to repeat the whole process again. And she says, oh, we can't find the file, or the number was not here. Okay, you'll wait, we'll look for it. So at the end of the day, it makes Medicare cumbersome. It makes it difficult to do continued management. So that's where we had to start from. So we had to start from the basis. The basis was getting good records for patients, allowing patients to be sure that whatever was done to them in the last 2 years is available in the last 10 minutes. They can get it within 10 minutes. So we developed a software called eClinics. eClinics now has run for 5, 6, 7 years now. This is probably the 6th year of running. The software had the ability to integrate different departments in different hospitals. We bought the software and brought it to the first hospital. I think the first hospital was Abuja Clinics, and here in Abuja here. And of course, we faced the challenges. Challenges were simple and were expected. People in hospitals, the doctors, older doctors were like, gosh, how come we can't use computers to see patients? We're used to the papers, just give us our papers. The ones in the lab say, oh, we cannot start documenting everything. The cashiers are thinking, oh, the extra 300 naira we collect from patients would have to go to the system. No, so there were challenges from people, from patients, from the doctors, from different centers. Then, even personally, my own challenge was, gosh, are you sure we're going to be successful? Do I think I will have to still go back to my medicine and internal medicine because there was no salary from anybody? I had stopped salaries, obviously. So at that point, the breakthrough normally came in, and the breakthrough is I think is more or less being persistent, being consistent, and thinking it will work. Was when another doctor that came from the States also said, this is a system that will work, and together we actually made a focus. And after we got the breakthrough in one hospital, that was, I think, Abuja Clinics, we then started improving. So within 3 years, hospitals like Limi Hospital, Zankli in Abuja, Annunciation Hospital, the specialist hospital in Enugu, bigger hospitals like State House Medical Center were fully computerized. We broke the barrier. People now accepted, implemented. Right now, I think Ministry of Defense currently has the most updated version of the electronic healthcare, so that when you come to any of these hospitals, for example, you come there, see the desk officer, they just take your details, it's computerized there, it's forwarded to a doctor, forwarded to the pharmacy, forwarded to the clinic, the clinician forwards to the... So everything now is integrated, it makes it faster. You can see a doctor within 1 minute and you're off, because the system now schedules your appointment, you don't have to wait for so long. So it became so interesting, and obviously the other success will come around with it, even though I never actually thought about it, financial success. My advice is that we should start make our people think outside the box. You don't have to do what everybody does. You don't have to wait for a salary job to come in. You don't have to think that I'm going to submit my resume. You start thinking about what you can do. But more importantly, make it different from other people. Make it something. It will be challenging, obviously, because it's not the regular thing, it's not the status quo. But at the end of the day, when people see the life in it, then trust me, the sky is the limit. And I think we all can achieve what we can do when we know that, as I used to say, yes, we can do it.